You'd like to ask me today, what are the signs and symptoms that I should look for if I suspect that I have breast cancer? One of the most important things that we tell the women today is to know your breasts. Do you know your breasts? Do you understand your breasts? Do you know how to examine your breasts? In our talk today, we'll also be able to show you how to examine yourself. Non-expensive, self-administered way of checking your breasts to exclude earliest sign of breast cancer. What should you look for? 1. Any lump that develops in your breast and persists beyond your normal menstrual period should be checked. Extend the examination of your breasts to under the armpits. Remember, the milk line extends from the armpits down to the pubic bone. So remember, when you're checking your breasts, you must also check under the armpits. Changes in contour, changes in size, changes in color, nipple retraction. What is nipple retraction? If your nipple is pulled backwards, and especially if it is of recent onset, you should make sure that a medical person checks and confirms that there's nothing abnormal. What are the other signs that you must look out for? Nipple discharge, and specifically bloody nipple discharge. If you have a bloody nipple discharge, it must be checked. And cancer of the ducts, which is the most common cancer today, must be included. Apart from breast self-examination, which I said is free, self-administered, there is the clinical breast examination done by a medical specialist. It's advisable that whenever you see your physician or whenever you see your medical care giver, you should have your breasts examined to exclude any changes that you might have missed out during your breast self-examination. Then, of course, we have the other tests that have been developed, have been proven over time to be effective in detecting cancer early. And one of the most important tests is the mammogram, which is the application of soft x-rays to the breast, and images that are gotten are able to detect whether there is any abnormal cancer site within the breast. The images are read by a specialist like me, and we'll decide, or we'll be able to know whether there's anything strange starting out. Remember, the mammogram can detect breast cancer before you can even feel it. And that's why you've had the terms in mammogram, the screening mammogram and the diagnostic mammogram. What is screening mammogram? In the Western world, they have mass population screening mammograms, whereby they go out into the fields or within the hospitals and call upon all the women above 40 years to have a yearly screen of their breasts to detect any cancer that may have started. Then we have the diagnostic mammogram, where among the symptoms that are already referred to earlier, if you have any of those symptoms, then the diagnostic mammogram is done to confirm your suspicions and also to guide the clinician to know how far that cancer has gone. The other test that is also been developed and known to work over time is the ultrasound. Ultrasound is using ultrasonic rays to look at the breast. Very important for a very young breast, a breast below 40 years of age, because a breast below 40 years of age is dense and may not be well visualized in a mammogram. So ultrasound is the examination of choice. Ultrasound is also used for people who have been confirmed to have a suspicious lesion on a mammogram, to be able to target and describe that lesion, as well as also to help the clinician to pick a sample of that area for laboratory diagnosis to confirm the type of cancer that you have. We have MRI, another system of imaging, very important for checking breast cancer. MRI stands for magnetic resonance imaging. Very important also for women who are suspected to have the BRCA1 and BRCA2 mutation gene, because then it means that screening for these women can start at a much earlier age with a safer method of imaging, the MRI. And MRI is available now in this country, and it's affordable. MRI is also very important for women today for breast care. It's important for checking the extent of disease. It's important for following up treatment for those who've started treatment on cancer. And it's important for checking whether the disease has spread beyond the breast. The other test that is very important for the breast is minimally invasive biopsy procedures. We have the fine needle biopsy that is insertion of a small needle into the suspicious area of the breast under ultrasound guidance or under mammographic imaging, and the cells are taken to the lab to confirm whether there is actually an abnormal cell or not. Then the most important one after that is the core biopsy. Core biopsy takes a slightly bigger tissue that goes to the lab, and they're able to decide from then what type of cancer you've got, whether it's an aggressive type, whether it's a type 1, type 2, type 3, as they like grading them, and whether this particular type of cancer is amenable to hormone treatment or is it amenable to drug treatment. Very important to have a core biopsy for any woman who's been known to have a mass that is suspicious. Then, of course, we come to the treatment modalities for the breast. Most importantly is for you to have a one-to-one discussion with your clinician to understand the various options that are available. And there are various options that are available depending on the stage of your breast cancer. We have partial removal of the breast, especially in the area that the breast cancer is. Total removal of the breast. We also do have a situation whereby the doctor may decide that I want to give you treatment first before I do anything. And in these cases is whereby the tumor or the breast cancer has gone much further than just one area. Then we talk about neoadjuvant chemotherapy and radiation. We also do have radiation, there is radiotherapy to the breast area. Sometimes it's done before the breast is removed, depending on the size of that breast cancer, and most of the time it is done after the removal of that cancer. Then, of course, we have the various cycles of treatment that must continue, because remember, cancer escapes into the cells, into the blood system, and that's why you're always called upon to have very multiple cycles of treatment every so often. So remember, once you start your treatment, it's a lifetime commitment to making sure that nothing escapes. I'm here today to encourage you to have your breasts checked so that you can be able to have a healthy breast with no cancer. It is treatable if detected early. It's 100% curable if detected early. We have the various centers that are conducting breast screening this month of October. Please refer to our website to know where you can go to have your breasts checked. Thank you. As I said again, I'm Dr. Betty Bonass, breast imaging specialist, Kenyatta National Hospital and Scan for Life X-ray and Imaging Center. You're welcome to these two centers where I'm based and the various centers that are on our website that are nearest to you. Thank you.